Dr. Nadeem, you can start the web.
Yes, ma'am. Ma'am, I appreciate if you can make me host.
Yes.
Thank you. So I will just make our moderator a host so that. Can you? Miss Pooja ji, can you please make Rizwan ji as a co-host so that he'll be a moderator for this program? Pooja ma'am, are you there?
Yes, Dr. Nadeem. If you ask Mr. Rizwan to raise her hand, I'll make him
Yeah.
co-host.
Yeah, Rizwan ji, can you please raise your hand?
मैं ज्वाइन कर रही हूँ उसको पूरा लेकिन फिर डाल दूंगी सब कुछ कह रहा है कि मैं चाहिए
Did you find him, ma'am? Okay.
Yes,
Thank you.
yes.
Okay.
He's now co-host.
Yes, we can start now. Thank you very much, Ms. Pooja ji, and also HSSC team for inviting me for this webinar series on cupping therapy, which is where the topic will be on cupping therapy or management of cupping therapy in daily practice. Okay, so I'm Dr. Nadeem. I'm Ayurvedacharya and also run an association and master trainer in cupping therapy. So I will be the speaker and I would be loving to share you all the knowledge about the cupping therapy in the view of Unani, Ayurveda, and also from the management of cupping therapy in daily practice. So before we start up the class, let us understand the webinar overview, what and all we will be covering in this program that is will be for 1 hour. Yes, next. So in the next slide, that is webinar overview. Next slide, Rizwanji.
Sir, class ले
Okay, so we will take with the webinar overview. We'll understand about the introduction and general definition of cupping therapy. The reason behind we included this is just because many of the people are from the practitioner's point of view, are from the paramedics, some people from the assistant, and also some people are from general public as well. It is very a need of an hour for them to understand about the general definition of cupping and what exactly cupping therapy means to them. So now also hijama as per Unani system of medicine. So I can take just a normal.
Dr.
Yes.
Nadeem.
Yes. Okay, I received the.
Hello, Dr. Nadeem?
Yes, ma'am. I'm just sharing that
Yeah.
link, right? Yeah.
I shared the YouTube link in the chat box, so
Yes,
if
yes. Uh,
students can join through the same link.
yes, ma'am. I'm just sharing it to everyone so that the others can also forward it to our other groups. Kindly,
Right.
all the students are requested to please send this link to all our groups so that the other students who are waiting can join this link and can see the recorded live session from the YouTube. Okay. Appreciate everyone to send it right now, guys. Thank you. So, cupping therapy as per or hijama, that is as per Unani system of medicine. Since I would just give you a gist about the Unani system of medicine because that exactly is not my system, okay, or the complete practicing point of view. So I can just give what exactly how it works. And then cupping Rakta Mokshana as per Ayurvedic system of medicine. Of course, I'll give an understanding how it works from the Ayurveda system of medicine. Then classification of cupping therapy, then indication, contraindication management, cupping therapy, which is obviously a matter of question by which has been asked by many of the practitioners and also from many of the people who are practicing cupping therapy about its indication, contraindication, which is a matter of discussion as well. Equipments, I'll not be going much into it. Then we will understand about the management of cupping in daily practice. So, next slide. So now let us understand about the introduction of cupping therapy. So now the general introduction of cupping therapy. See, we need to understand cupping. Cupping aaj kya hai? Cupping aaj is just been used by the derivation of using just like an act of using cups. Cupping does this special word cupping did not had any derivation. It just been arrived. Kaise arrive hua hai? Just been by act of using those especially instrument made like cups which has been used over the skin region, इसको cupping कहा गया है. But actual derivation, if you will understand, lies, it derives from the word, from the Unani system of medicine, which is called hijama. Hijama is the word which is an Arabic word which has been derived by word hajam. Hajam means what? Sucking of the blood. Okay, so the act of sucking of the blood or the removing the the complete toxic blood out of the body is called hijama. Especially major consequences are being laid down over the wet cupping from the hijama point of view. So same way, if you understand the other part of the system, that is Ayurveda system, the rakta mokshana, it says rakta means blood, mokshana means freeing the blood from or toxic blood from the body, which is called rakta mokshana. So now we understand, see, rakta mokshana is also same way, removing the toxic blood from the body in order to improve blood circulation is called Rakta Mokshana, which has been majorly emphasized by Sushruta Acharya, which is one of the part of Panchakarma. So, if we understand these two systems where they have been using, that is a Unani system of medicine and also from the Ayurveda system of medicine, it is one of the therapeutical aspect which is always being used into the सिस्टम एंड ऑल्सो द ट्रीटमेंट. हम लोगों को एक चीज समझना जरूर चाहिए कि जब भी हम लोग एक ट्रीटमेंट करते हैं या कोई भी एक पेशेंट को जब हम लोग कंसल्ट करके जो भी उसका लाइन ऑफ ट्रीटमेंट सेलेक्ट करते हैं, जो भी कुछ मेडिसिन हो, जो भी हर हर कोई भी चीज हो, एक थेरेपेटिकल एस्पेक्ट हमेशा रहती है. जो भी एक थेरेपेटिकल प्रोसीजर है होता है, उनमें से एक प्रोसीजर को कहा जाता है कपिंग थेरेपी. समझ रहे हैं? आप ये मत सोचें कि मैं यहाँ पे अभी आप लोगों को जो भी शेयर कर रहा हूँ नॉलेज, जो भी मैनेजमेंट ऑफ कपिंग थेरेपी है, that doesn't mean that only cupping therapy will cure. It is not complete curability. Along with that curability, it is a preventive and also with the other medication and other aspects of treatment, it will fasten the recovery action और आपका जो healing process है जल्दी कर देगा. So that is the all motto of the cupping therapy, ताकि आप कोई भी कॉम्प्लीमेंट्री मेडिसिन, कोई भी कॉम्प्लीमेंट्री थेरेपी आप एक सिस्टम पे इन्वॉल्व करते हुए इसको कैसे ठीक से मैनेज कर सकते हैं. दिस इज ऑल अबाउट द कपिंग थेरेपी. ओके, सो नाउ बिफोर वी स्टार्ट अप the about the major aspect of cupping therapy, so let us understand what exactly the health is. A small understanding because it's regarding the health. So I would like to just take you with the what exactly health says. Okay, so just a small shloka from Ayurveda, because I'm an Ayurveda Charya. So since I'll be taking a small shloka from Ayurveda with regards to the swastha. What is health? So health means there's a very effective shloka which has been formulated and also been taken from the Shushruta Acharya. That is, it says sama doshaha sama agnikscha samadhatu malakriyaha prasanna atma indriya manaha swastha itya vidhiyate. That means to say that Sushruta Acharya, what does he describe? He's describing about the features of a healthy man. He says that dosha, sama dosha. What is sama dosha? That is vata, pitta, and kapha. Then sama agni, that is digestive fire. Sama dhatu, that is seven dhatus. And then mala, that is waste products. And kriya, if they are normalcy, along with, that is atma, that is soul. Indriya, that is sense organs. And manas, that is mind. If they are in peaceful manner, is said to be a health. Is said to be healthy. So this is about the a general definition of health and a swastha. So cupping therapy is an therapeutical system that is used almost every ancient civilization and discovers benefit to the world. Okay, so it is it is simple, very safe, harmless, cost effective, and works on every aspects of the body. So it refers to Chinese practice. It is earlier days, but now in India, if we understand about 10 years before, 12 years before, yes, of course, they were the one who have been into the major practice into this therapy. But now we understand about the Indian popularities and the Indian systems who are adopting these kind of therapies. Of course, it is a major contributions by Unani system of medicine who have made a lot of efforts in bringing the upliftment, and also the Ayurveda, then also the other therapeutical people who have really brought in the upliftment of this therapy is all about it refers about that, where a vacuum or suction in order to mobilize the accumulated blood, where a negative pressure is created to remove stasis of blood. Okay, what does it do? It uses a cup as a tool to expel the air from the cup through suction and other methods to form a negative pressure, like anchoring the cup over the treated site of the body to achieve the goal of preventing or treating diseases and strengthening the body. This general understanding of cupping is introduction of cupping. So we'll now let us understand about the definition of cupping. Yes, next. So this is the actually, if you will understand, it will say you the therapeutical procedure, what we exactly are doing it in cupping therapy. Definition of cupping is all about, it is an ancient traditional practice where instrument like cups. So you have seen the cup like instrument, like this shape like instrument. ये क्या किया जाता है, आपके skin layer के ऊपर लगाया जाता है, किस लिए? थ्रू वैक्यूम और सक्शन. कैसे वैक्यूम और सक्शन किया जाता है? विद द हेल्प ऑफ सक्शन गन होता है, जहां पे नेगेटिव प्रेशर क्रिएट होती है. अब ये नेगेटिव प्रेशर क्रिएट होने के बाद में क्या होता है आपके बॉडी के अंदर? टू अक्यूमुलेट द ब्लड, एयर, लिम्फ इन द कप्ड रीजन बीनीथ द स्किन. बीनीथ द स्किन पे जहां पे कप रीजन होता है, तो क्या क्या अक्यूमुलेट होता है? अक्यूमुलेशन ऑफ ब्लड, एयर, लिम्फ, बहुत सारे और पैथोलॉजी है. हम बहुत डिटेल में नहीं जाएंगे, जस्ट अ जनरल अंडरस्टैंडिंग कर रहे हैं यहाँ पे. ठीक है. एंड देन आफ्टर अ स्टिपुलेटेड टाइम हम लोग एक स्पेसिफिक एक्शन इज परफॉर्म्ड, एक स्पेसिफिक एक्शन किया जाता है. किस लिए किया जाता है? आइदर टू रिमूव और मैनिपुलेट. Now removal and manipulation goes in two aspects. So we all know that cupping has two major types, right? Or two major classification. One, it is a dry cupping, another it is a wet cupping. So one, that which removes is what? Wet cupping. It donates to wet cupping, and that which manipulates goes to the dry cupping, the stasis of blood. So the major aim of cupping therapy is what? The major aim of cupping therapy is to improve blood circulation and promote healing. So this is all the general understanding of cupping therapy. If you will understand this detail, will tell you exactly the complete therapeutical procedure from the time of application up to the manipulation or the removal. It will say your complete understanding about cupping therapy, but the major aspect is or the aim is to improve the blood circulation and promote healing. Okay, next. This is about the definition of cupping therapy. Okay, so now let us understand about the uh, uh, yes. Before this, we will understand the general primary mode of action of cupping therapy. So the three major mode of action of cupping therapy is one is what? Negative pressure. Second is what? Vasodilatation. तीसरा क्या होता है? Exchange fluids, enhance of fluid exchange which takes place is also, these three are the major mode of action of cupping therapy. अगर हम लोग ये आगे primary mode of action देखो, there are lot of theories been behind about the mode of action of cupping therapy. One of the which is a very most famous theory which is called as Taiba theory, which is been given in detail about the how the primary mode of action of cupping therapy usually takes place in each and every step of the procedure. But here we are just understanding on an overview how exactly the mode of action is taking place. Okay, let us not go deep into the Taiba theory. So now understanding the mode of cupping therapy. So there are three things. One, it is a negative pressure. You must have seen once you apply the cup apply करने के बारे में वहां पे एक upliftment होती है, right? वो upliftment is nothing but जहाँ पे आपके सक्शन गन के तरीके से जो होता है, जहाँ पे इंटरस्टीटियल डेब्रिस वगैरह जहाँ पे फॉर्म हो जाता है beneath the skin region, तो वो सारा का सारा नेगेटिव प्रेशर की वजह से होता है. दैट इज द रीजन इट स्टार्ट्स अक्यूमुलेटिंग ईच एंड एवरी ब्लड, आरबीसी, ये सारा इंटरस्टिशियल डेब्रिस, मास्ट सेल, ये सारा चीज जमा करना शुरू कर देता है. दैट इज मेजरली बिकॉज दैट इज फर्स्ट वन, इट इज नेगेटिव प्रेशर. Understand, the cups is been applied onto the skin, in turn uplift the tissue which creates negative pressure. जब यहाँ पे क्या होता है, there is accumulation of stasis of blood, RBC, capillary blood, not venous blood or arterial blood, but it is only the venous and arterial also is being given a pressure. Okay, pressure over venous and arterial we can say, but not blood. Okay, so now mast cells and the interstitial debris under the cupping pocket. Cupping pocket, what is cupping pocket? Once we apply the suction, you must have seen there is an upliftment of the skin, right? That is the cupping pocket which we usually say. Once the cup is released after a specific period of time, क्या होता है? The oxygenated, तो obviously हमारे इसमें क्या होता है, एक आके oxygenated होता है, एक आके deoxygenated blood होता है, right? So one oxygenated blood जो rich nutrient blood होता है travels to its own position within a fraction of second. ये कब होता है? Only once the cup is released after a specific period of time, after the suction has been applied, when the negative pressure is created, right? After that, जब ये release होता है तो oxygenated blood will travel to its own position. On the other hand, what will happen? The deoxygenated blood, which is the metabolic waste blood, travels very slowly and to its own position by sedimenting from the cupped region. ये क्या होता है? Slowly sedimentation होता है. So before the sedimentation crosses below the epidermis region, अगर आप हमारा स्किन का लेयर समझेंगे जहाँ पे एपिडर्मिस, डर्मिस, हाइपोडर्मिस, बिलो द एपिडर्मिस रीजन, तो वहां पे हमारा टॉक्सिन्स, या जहाँ पे वेट कपिंग स्पेशली अगर हम लोग कर रहे हैं या ड्राई कपिंग कर रहे हैं, तो हम लोगों को एक्शन लेना पड़ेगा. दैट एस्टिमेटेड टाइम फॉर दैट एक्शन we take it as 10 to 30 seconds, okay, which needs to be incised before the deoxygenated blood travels below the epidermis region. Because what happens, अगर आपका deoxygenated blood epidermis region के नीचे चला गया, and then if in case you are thinking that you want to do wet cupping therapy, तो क्या होगा? It is mainly because of the injury to the epidermis. इंजरी टू द एपिडर्मिस होने की वजह से क्या होगा? आपका ब्लड निकलेगा, that will actually not be the actual form of deoxygenated, because our main purpose should be, you know, removing the blood which is in the form of deoxygenated or in the form of toxic. That is the reason we say cupping is very effective in detoxifying our body. That means to say that हम लोग toxins को बाहर निकाल रहे हैं. ठीक है? Then next, then a specific action is done either through dry cupping or through wet cupping in order to initiate vasodilatation. As I told you, the second process is what? Vasodilatation. Vasodilatation is what? हम लोग यहाँ पे क्या कर रहे हैं? हम लोग यहाँ पे कैपिलरी, अगर हम लोग इन द फॉर्म ऑफ वेट कपिंग कर भी रहे हैं, तो व्हाट आर वी ट्राइंग टू रिमूव? वी आर ट्राइंग टू रिमूव द ब्लड इन द फॉर्म ऑफ कैपिलरी ब्लड. Once the capillary blood is expelled out of our body, what happens? Then it takes, the blood vessels gets dilated. In turn क्या होगा? Widening of blood vessel होगा. Then ये activation of relaxation of smooth muscle वो area में cup में हो जाएगा. Then leads to blood circulation, which is our main motto of cupping therapy. This is about the process of vasodilatation, how it creates. Then it leads to finally enhanced fluid exchange. यहाँ पे क्या होता है? कैपिलरी होस्ट जो होता है, जहाँ पे वेरियस फ्लूइड एक्सचेंजेस प्रोसेस जहाँ पे होते हैं हमारे बॉडी में, जहाँ पे एक ये चार ट्रांसपोर्ट प्रोसेसेस जो होते हैं, डिफ्यूजन, फिल्ट्रेशन, ऑस्मोसिस, एक्टिव ट्रांसपोर्ट प्रोसेस जहाँ पे होती है, तो क्या होता है? इट हेल्प्स इन फ्लूइड्स टू फीड सेल्स व्हाइल रिमूविंग द मेटाबॉलिक वेस्ट ब्लड एट द सेम टाइम. So in turn, what will happen? It helps in lymphatic drainage and helps in increasing the lymphatic circulation. So that is our main motto. So these three things, that is the reason these three things are very much taken into picture. One, it is negative pressure. Second, it is vasodilatation. Third, it is the enhanced fluid exchanges, which takes place during the complete process. As an overview, I'm telling you, I'm not going in detail. So this is how the complete structure takes place. Now, due to this suction pump effect on the body, cups encourage venous return and lymph movement, which leads to blood circulation and promote healing. So this is the complete understanding about the mode of action of cupping therapy. Clear? Now next. Yes, now we go to the cupping or hijama as per Unani system of medicine. Yes, of course, cupping therapy is performed mainly by two different systems of medicine, namely Unani and Ayurveda. Under Unani system of medicine, cupping therapy is widely known as hijama therapy, which is an Arabic word. Okay, the word cupping was derived, that is from the word Arabic verb hijama or hajama, which means to minimize or to reduce in size or to diminish in volume. Hijama in Arabic is derived from hajam, which means sucking. Okay, therefore, hijama is a process of application of cups to various points of the body by removing the air inside the cup to form a vacuum. This is the general understanding of cupping as per Unani system of medicine. Okay. On another derivation is hijama could be taken from Arabic word ahjama, which means to withdraw or retreat from attack. Okay, so there are different derivation or these synonyms taken from the different derivation. One says ahjama, one say hijama. So this is about the complete derivation which is taken from the Unani point of view. Ancient Unani practitioners use hijama as a regimental therapy that was used as manipulative technique to move out stasis of blood. Prophet Muhammad peace be upon him, okay, taken hijama several times and discussed about benefits of hijama and enhance the use of hijama in Islamic medicine as prophetic medicine. So that is how the popularity has been gained, and many of the people have started accepting it, not only with the therapeutical aspect, but from the metaphysical aspect of the treatment as well. Yes, next. Now let us understand the concept of bloodletting procedure, that is Rakta Mokshana according to Ayurveda. And we all know Ayurveda, it is Ayu plus Veda, that is, as we all know, Ayurveda is a science of life which emphasizes on maintaining and promoting the health and also preventing the diseases by adopting various lifestyle, dietary, therapeutical procedures for a perfect swastha. So here, that's what it says. The major thing is swastasya swastha rakshanam, that is swastha vrita. Swastha vrita, that is preserving the health of a healthy person. Then atura vritam, the aturasya vikara prashamanascha, that is that is preventing the disease of a diseased person. Okay, so this is about the holistic approach to the healthcare that helps people to lead a healthy and balanced life is all about Ayurveda. Next. So I'm not going in detail. I'll just tell you about the definition what Dr. Mokshana says. The surgical procedure. So it's now a minor surgical procedure in Unani from the Taiba theory, and also from the surgical procedure of allowing the blood to let out or flow for therapeutical purpose is known as Rakta Moksha. Rakta is blood, as I told you earlier, and letting out the impure blood from the body as Rakta Mokshana or Mokshana it is. What does Mokshana means? Liberating, emancipating, shedding, or causing to flow. That which is causing to flow out the toxic blood. Okay, Rakta means that is toxic blood. Okay, again in Ayurveda we have the features of pure blood and impure blood and all that. Again, theory goes into detail. We'll not go into that much. We'll just understand that the liberating or removing the rakta, which is toxic in nature, from out of the body, is called Rakta Mokshana. Now synonyms we'll understand. Again, we call it as Sira Vedana, Rakta Javikara, Jalauka Vacharana, and Prachana Karma. Okay, next. Now, classifications of cupping therapy. In this session, we will understand about the classification of cupping therapy according to Unani system of medicine. The one it is dry cupping. Dry cupping it called as hijama bila shart, okay, which is non-invasive cupping or cupping without bloodletting. It is act by diversion of morbid matter from one side to another, which is called imla mawad. And then the other classification is wet cupping, hijama bil shart, invasive cupping or cupping with bloodletting. It is act by evacuation of morbid humors from affected area, that is what Tanikya Mawad. Again, from the hijamat bilashar, that is dry cupping, again they are subclassified into two, which is bilanar and another bilnar. Bilanar, it is vacuum created by manual suction pumps, okay, and bilnar, it is vacuum created with fire. Again, essential and voluntary cupping goes on the both the aspects. One, it is from the hijama aspect, another it is the pathological aspect, which they call it as essential cupping and voluntary cupping. Yes, next. Now we'll understand about the classifications of Rakta Mokshana according to Ayurveda. Rakta Mokshana bloodletting, one it is Shastra Prayoga, Anu Shastra Prayoga. Now, Shastra Prayoga, it is in order to drain the accumulated blood from a particular point of body by using Shastras. What is Shastras? Shastras are sharp instruments. It is further classified into two types, that is Prachana, that is bloodletting, by which making a multiple incisions. Another, it is Sira Vedana, which is called Vinipanchar or Vinisection. Okay. Now, coming to Anushastra Prayoga, now here we decide or do the treatment as per depending on the doshas. Now, considered as pathogenic factors or disease causing agents in the body, it is classified into four types. पहला आकर जलौ का प्रयोग, पहले आके जलौ का प्रयोग, that is use of lead. जलौ का प्रयोग is majorly used in what? It is used in pittaja disorders. Okay. Then Shringa Prayoga, use of horn, it is used in Vata disorders. Alabhu Prayoga, it is use of bottle guard, a vegetable bottle guard, it is being used in or any kind of kapha disorders. And again, Yantra Prayoga, Ghati Yantra, it is like an earthen pot. Okay, if you can see the olden way of using the cups with the help of a suction was like a like how we today say matka bolte hain na hum log. ठीक है, मटका made of mud pot. Okay, that pot like a ghati yantra, that was an yantra, like a blunt instrument which is being used with the help of a fire to attain the suction. That was called yantra prayoga. Okay, next. Now, classification of cupping according to physiotherapy. So since physiotherapy, if we will understand that it is this special classification of cupping, it is not there in the syllabus, but since many people are showing interest, popularity and other things into cupping therapy, and are doing lot of and making lot of differences in the musculoskeletal disorders, neurological disorders. So now we have just brought this as a general classification for them from their point of view. One, it is cupping therapy as a static cupping, another it is dynamic cupping. Static cupping is that which stays there at a particular region without any movement. So again, static cupping has been subclassified into three, which is light cupping, medium cupping, and strong cupping. Light cupping is something where the pulling of the suction gun is about one pull, two medium is two pulls, and strong cupping is three pulls. And again, coming to the dynamic cupping again now subclassified into two. One, it is the manual dynamic cupping, another it is uh, electric stimuli or electric stimulators, or the electric dynamic cupping, so with the help of a machine. So dynamic cupping is something like a movement which is being made with the help of cups, okay, with the help of a cup, and another electric stimuli which have been which have been done with the help of a machine. Okay, next. Classification of cupping according to TCM, that is traditional Chinese medicine, that is cupping. Again, they only have two things, which is dry cupping, another they say wet cupping, bleeding cupping, full cupping, but they don't use invasive or incisional method. They do some pricking method from the Chinese point of view. Okay, so there is no so we cannot relate TCM wet cupping and the Ayush wet cupping together, because it goes from the very different understanding. They go into the pricking method. We from the Ayush practitioners always go with the incisional methods. Okay, dry cupping, again they have done a vast understanding and research on the dry cupping. Of course, that is how the dry cupping and wet cupping have been bifurcated from TCM point of view. Next. Now again, this is one more classification which is called as physical and metaphysical point of view. Cupping therapy not only aims to treat physical aspect but also metaphysical aspect is one of the basic treatment principle to cure the disease. Now, since this cupping therapy, if you understand from the physical point of view, so physical point of view, what and all we can be targeted, that is organs and viscera, affected areas, spinal vertebrae, and magnetic cupping. These are actually our new phase of cupping, where people can obviously perform cupping on these aspects. Now coming to the metaphysical point of view, there are some horary points or sunna points which we call metaphysical point, and other points are chakras, marmas, where again we can perform cupping on those region and bring a lot of therapeutical changes in our body. And then again, energy system of human body, these are again some of the points where we can bring changes in our body. We need to understand that why physical and metaphysical has been bifurcated over here from the therapeutical point of view. So now, for physical aspect, so these are the things where which we work on the pathological aspect of our body. Okay, understanding the pathology, understanding the organs, understanding the spinal nerve supplies, and accordingly we understand and control and manage the disease accordingly. And then coming to the metaphysical aspect, the horary, energy, chakra, marmas, all these things are imaginary points. Okay, these are imaginary point, but no doubt it is giving a very effective result if we understand from the metaphysical aspect. So that is the reason these works from the metaphysical aspect, and the physical aspect, these works without even having any intention or consciousness. The physical aspect will work, but for metaphysical aspect you need to understand where the imaginary points are, and accordingly you do it, then the metaphysical works. Okay, this is about the therapeutical aspect. Okay, next. Okay, so very quickly, I'm just finishing this with the indication, contraindication, and management in cupping therapy. Okay, indication age, dry cupping 1 to 70 years, wet cupping 70 to 70 years. Okay, this is depending on the diagnosis. This, see here, these references, whatever the references I have taken from the Ayurvedic book. Okay, from the well-known verses and other thing, where completely these indications are being shown. Okay, because we did not find a perfect references in regards to indication, contraindication, and management. So again, season they have mentioned dry cupping can be any season, wet cupping any season, but more effective in winter season. Skin disease, for all skin diseases, wet cupping will be for dermatitis, herpes simplex, eczema, psoriasis. Psoriasis, again, we need to see to that if you are performing wet cupping, psoriasis should not be performed if there is any kind of Koebner phenomenon. Webinar phenomenon, there is one examination which has been done over the skin region, and if that is positive, we should not be doing cupping therapy, okay, except Webinar phenomenon. Then alopecia areata, filariasis, urticaria, acne vulgare, boils, leprosy macules, scabies, fungal infection. Then again, musculoskeletal disorders, dry cupping, all MSK disorders, wet cupping, for the cervical spondylitis, slip disc, frozen shoulder, tennis elbows, sciatica pain, osteoarthritis, rheumatoid arthritis, writer's cramp, piriformis syndrome, right, then carpal tunnel syndrome, hamstring muscle injury, ankle sprain, plantar fasciitis, calcaneal spur, muscle dystrophy, and lame. Then again, coming to gynecological disorder, dry cupping, all gynecological disorders, it is indicated. Wet cupping over amenorrhea, dysmenorrhea, polymenorrhea, infertility, metorrhagia, PCOS, PID. Next. Then digestive disorder, dry cupping, all gastrointestinal disorders, wet cupping, IBS, gastritis, GRD, reflux, gastric ulcer, nausea, vomiting, stomach spasm, peptic ulcer, UC, then again constipation, diarrhea, abscess, fistula, fatty liver, splenomegaly. And again, psychological. But again, understand indication from the management point of view. It is indicated, okay, but doesn't mean that it is. This is only the point of treatment. So along with this treatment, you always, from the practitioner point of view, don't only depend on the therapeutics. You should always also have medications also accordingly. Okay. Then psychological and nervous disorders, dry cupping, all psychological conditions, wet cupping, stress, anxiety, insomnia, depression, insanity, forgetfulness, Parkinson, delirium, trigeminal neuralgia, dementia. Then metabolic and endocrine, all metabolic, then blood pressure, diabetes, mellitus, thyroid, prostate gland, PCOS. Then circulatory and respiratory, all circulatory, respiratory, wet cupping, blockage, cholesterol, hypertension, varicose veins, cough, dyspnea, hiccup, URTI. Then again, urinary disorders, all urinary issues. Then again, coming to wet cupping, incontinence, retention of urine, UTI, renal calculi, renal colic, nephrotic syndrome. Others, dry cupping, all diseases can be managed as complementary treatment. Yes. Then fever, edema, weakness, weight loss, pimples, and hair fall. Next, please. Okay, now we are going to the precaution पे precaution किन किन चीजों पे लेना है and reason for precaution. I'm just taking it into दो से तीन एक ही हैं. एक आके pacemaker, any other battery operated electric implants, device placed on or near the heart, the stent valves, heart problem, angina, जितना भी cardiac disorders हैं, ठीक है, ये वहाँ पे you will not be doing cupping, okay, and then you can do it around the surrounding region. Organ transplanted, had organ removed, especially the colon, hijama wet cupping cannot be done, but can be done for other indicative over other region. Then during menstruation cycle, wet cupping, especially I'm speaking about wet cupping, during menstrual cycle should be avoided, may disturb the physiological and endocrine response to menstrual cycle. Hence, in chronic cases, may be indicated seeing the condition of patient. Next. Then again, tendency to faint, blackout, वगैरह पे you should avoid doing cupping therapy. Then any psychological insanity, psychotic episodes, seizures, वगैरह इनका जितना भी है, you need to always take history. If they are lying at that particular disease, then obviously should avoid, but dry cupping may be indicated. Open wounds, cuts, injuries, non-healing ulcers, all these things should be avoided, but can be done around surrounding regions. Metal joint implants can be done around surrounding regions. Okay. And then on blood thinning medication, hence should be stopped at least 2 days prior. If it is very chronic, 1 day prior. Okay. Next. Ruptured ligaments, swollen, phobia, blood clots has to be avoided. Okay. And the reason behind is because those are blood related disorders, and also leukemia, thrombocytopenia, SRA, blood related disorders, and you should be avoiding that. Yes. Next. Then contraindication, I'm just taking it like that. Age wise is same, below 1 year, dry cupping pay, seeing the strength of patient, infant, old man, past man. Psychological, ये सारे के सारे psychological हैं, dry cupping and wet cupping. And this is how the complete understanding about physiological conditions are there. So you all can have a complete just understanding, because we are just we need to go to the management. So I'm just little expediting and covering this slides. Next slide, please. disease condition, these are complete disease conditions जिन पे dry cupping is contraindicated and wet cupping is contraindicated. Okay, and then psychological conditions again, ये सारे के सारे psychological condition, and anything which may worsen the condition by doing dry cupping or wet cupping should be contraindicated. Okay, so these helps us to understand about what exactly is about indication, precaution, and contraindication. Next, equipments will not go, will go directly to management, because we are just lacking behind time. So we need some more time to finish the management of cupping and daily practice. Yes, go ahead. So here, so we are doing one by one. That is we are doing for the cervical spondylitis. Okay, so cervical spondylitis, I will not go in detail what exactly the cervical spondylitis are. It is now the cervical spondylitis also has been called as neck pain. Generally we call spondylosis, we call cervical disc bulge, we call. Okay, there are many causes behind that. Okay, many of the the first for the many of the things will be like dull pain, throbbing pain होगा, फिर उसके बाद में IVD, that is intervertebral disc prolapse होगा, जहाँ पे जहाँ पे बहुत सारे इंजुरी वगैरह की वजह से बहुत सारा विल बी herniated disc होगा वहाँ पे, फिर again protrusion, extrusion, all that usually comes into play. Then throbbing dull pain होगा, then again dizziness, vertigo, all these things usually are a part of cervical spondylitis. So simple from the management point of view, हम लोग क्या करेंगे, what we are trying to do, wherever the pain is, pain जहाँ पे भी है, आपको सही से रीडिंग करें जहाँ पे भी है, एक्सेप्ट डीजनरेशन के लिए मैं अलग बताता हूँ, जनरल सर्वाइकल स्पॉन्डिलाइटिस पे कैसे मैनेज करें वो बताता हूँ. अब एग्जांपल, कुछ भी आप वेट लिफ्ट करने की वजह से या पोस्चुरल डिफेक्ट होने की वजह से वगैरह जब भी आपका ऐसे आपका हुआ है, तो इमीडिएटली आप क्या करें, इमीडिएटली व्हाट यू विल डू इज यू विल अप्लाई कप ओवर द पेन रीजन, और जहाँ पे डलनेस, पेन का डलनेस या थ्रॉबिंग पेन है वो एरिया में कप लगाए कंप्लीटली रेडिएशन पे. सो मेजरली प्रिफर्ड इफ इट इज वेरी अक्यूट केस, व्हाट यू विल डू इज यू विल अप्लाई व्हाट, आइस कपिंग. कुछ नहीं करेंगे आप, बस आइस कपिंग क्या करो, 5 मिनट तक लगा दें आप. देखो मैं अभी आपको ये आपके इमरजेंसी मैनेजमेंट में डेली प्रैक्टिस के हिसाब से बात कर रहा हूँ. क्रॉनिक डिजीज के लिए वो एक अलग थियरी होता है, अलग मैनिपुलेशन टेक्निक्स होते हैं, उसको मैं अभी आपको नहीं बता रहा हूँ. मैं आपको ये बता रहा हूँ कि जनरल कंडीशन में आप सर्वाइकल स्पॉन्डिलाइटिस को कैसे आप मैनेज कर पाओगे. ठीक है ना. अब ये एरिया जैसा कि सर्वाइकल एरिया में आपका है, वहां पे आप देखिए आसपास के मसल्स कौन से इन्वॉल्व हैं, और वो पर्टिकुलर एरिया में जहाँ पे सर्वाइकल एरिया पे, जहाँ पे सर्वाइकल 5 हो जाए, 6 हो जाए, 7 हो जाए, वो एरिया में कप लगाकर, आइस कपिंग लगाकर 5 मिनट छोड़ दें. 5 मिनट छोड़ के बस आप कुछ नहीं करना है. कप के अंदर आपको आइस रखना है, आइस क्यूब एक रखना है, एंड यू कीप इट फॉर 5 मिनट्स. सी टू इट दैट डोंट see ice cupping simple. What you do is take ice cube and keep inside the cup and immediately place over the affected region. Keep it for 5 minutes. That is ice cupping. Okay, that will help in pain relief. बहुत सारा क्या बोलते हैं, पेन को कम करता है वगैरह. सर्वाइकल स्पॉन्डिलाइटिस इन्फ्लेमेशन को कम करेगा. वो एरिया का आप देखेंगे मोबिलिटी भी थोड़ा बहुत अब बहुत अच्छे तक इंप्रूव हो जाएगा. Immediately, these are immediate emergency management I'm telling you from the cervical spondylitis. Clear with this? Okay, then I'll give you the questions later. Then you will ask me one by one. See, I'm not telling about the degenerative problems. जहाँ पे degenerative problems होते हैं, जहाँ पे osteophytes हो जाते हैं, जहाँ पे nerve compressions हो जाते हैं, there needs lot of different manipulative techniques. So which cannot be told, that has to be controlled and managed through pathologically also and medicine also. ये मैं बस आपको how you can do it in the daily lifestyle by emergency management वो मैं आप लोगों को बता रहा हूँ. Clear है? Come next. Now, sciatica pain. See, annular tear, obviously, you need to understand how will the annular tear will work in this. ओके एनुलर टेयर के लिए नहीं होता है क्योंकि उसके लिए रेस्ट चाहिए होता है ना, तो ऑब्वियसली एक हद तक थोड़ा बहुत मैनेजमेंट कॉम्प्लिकेशंस को मैनेज कर सकते हैं, पर एनुलर टेयर को रिपेयर नहीं कर सकते, समझ रहे हैं। देन कमिंग टू साइटिका नर्व पेन, साइटिका नर्व पेन यहाँ पे पूरा का पूरा साइटिक नर्व पे आप बस मैनेजमेंट देखो। साइटिका नर्व पेन इज अ न्यूरोलॉजिकल प्रॉब्लम, ठीक है। अब ये न्यूरोलॉजिकल प्रॉब्लम है जहाँ पे स्पेशली लंबार के जितने भी नर्व हैं वहाँ पे कंप्रेशन होता है। कंप्रेशन की वजह से ये पूरा का पूरा नर्व साइटिक नर्व हैम्पर्ड हो जाता है, जहाँ पे पेन, स्टिफनेस, नमनेस, पैरेस्थेशिया, ये सारा का सारा कंप्लीटली हील तक होता है। एंड सम पीपल अगेन इस पे भी डिपेंड होता है कौन से लेवल पे कंप्रेशन है और अलग अलग जगह पे इसका रेडिएशन होता है। तो सिंपल अंडरस्टैंडिंग दिस रेडिएशन सिर्फ आप लोग, मैं बता रहा हूँ कैसे इमरजेंसी मैनेजमेंट करें। फॉर एग्जांपल किसी को भी साइटिका पेन है, आप बस क्या करो, डू स्ट्रॉन्ग कपिंग, डू स्ट्रॉन्ग कपिंग, 3 कंप्लीट पुल ऑफ द गन, गन जो है आपका, गन का 3 कंप्लीट पुल करें ये सारे एरिया में, कहाँ से, लंबार से लेके साइटिक नर्व से लेते हुए और जहां पे रेडिएशन पाथवे होता है वहां तक, ठीक है। अब वो कंप्लीटली रेडिएशन करें, दिस विल हेल्प इन। Yes, of course, we will ask. Please, now you don't disturb. Give me 5 minutes. We will just finish this, and at the end, we will give everyone opportunity to ask the questions. Okay. So now, so once so this pathway is being chosen, and we apply 3 complete pulls of the gun. So once we apply 3 complete pulls of the gun, you can see the complication and also the pain and other things are being managed simultaneously. So again, here also I'm telling you, see, these are some of the chronic diseases which has to be understood from the pathological point of view, and also should be controlled by the system level. So completely, I cannot say that only doing this will obviously cure from the disease. But yes, of course, I'll tell you that the percentage of pain and the percentage of numbness and tingling sensation, whatever the patient is having. So here the patient can see a lot of benefits, and also he can see that the pain is obviously coming down immediately after applying the cups and keeping it for 5 minutes. You need to keep strong cupping, which is 3 pull of the gum for 5 minutes, and you will see obviously that the pain subsides down for some while, or maybe for some hours, or maybe for a complete day. So that is also very good effect, right? Just by applying some cup without having any medicines, without having any analgesics, you are getting pain relief immediately after applying the cup. That itself is a very effective results for you all. Okay, this is how you manage the pain wise from the treatment aspect. Okay. Next, plantar fasciitis. Okay, plantar fasciitis is again it's a plantar fascial ligament which is involved here. You must have seen anyone getting early from the bed, the step you put down, you must have seen the pain, there's a pain radiating in your heel region, right? That is plantar, not heel and also plantar region. So in this case, what you will do is simple, since it's an inflammatory condition, nothing you will do for plantar fasciitis, apply ice cupping. Simple, I'm telling you, ice cupping over this region, the plantar region, the 3 cups near the plantar region, and keep it for 5 minutes. You will see drastical improvement, and also you will see very effective results, and the pain being subsided, inflammation coming down, and mobility will also increase. Okay, you will see for especially plantar fasciitis, the people who are affected with that, they are unable to walk few steps immediately after getting up from the bed, or after resting also. Even if you rest for a specific period of time, and even if you try to walk, also you will see this kind of pain. So during in these conditions, what you will do is you will apply ice cupping over this point, over this plantar region for 5 minutes, and you will see very effective results. Clear? Next, frozen shoulder. Of course, frozen shoulder is again one it is adhesive capsulitis. So again, due to the pathological disturbances, one gets frozen shoulder due to many causative factors are many. Majorly, we'll understand from two point of view as of now for emergency management. One, it is post-diabetic frozen shoulder. Another, it is frozen shoulder which occurs due to any kind of pathological disturbances like lifting weight or posture or any kind of injury or something like that. So if it is due to injury, if it is immediately injury, fallen down or something, unable to make any kind of mobility, or where there is restricted mobility, stiffness is there, simple what you will do is, this is I'm telling you on acute conditions, okay? I'm not going to the chronic conditions like post diabetic frozen shoulder. So now coming to the the injury part of frozen shoulder. So if it is there, simple what you will apply, simple, I'll telling you, ice cupping is playing important role in all kind of musculoskeletal disorders. Don't think anything, just apply either ice cupping or do any kind of three complete pull of the gun, which is called a strong cupping over that particular region. So once that happens, what will happen, that area get the inflammation comes down, the stiffness gets reduced, and also once you remove the cup, when the blood circulation takes place, that area surrounding muscles will get into strengthening, come into functioning, and also the mobility will also improve. So I'll tell you, it is showing very effective results in any kind of acute frozen shoulder which has happened due to injuries. Now coming to the post-diabetic frozen shoulder, again in post-diabetic frozen shoulder, we have three stages again that has to be controlled with the pathological conditions itself, that cannot be controlled with the emergency management. But of course, in emergency management, what you can do is, okay, in that in the particular area, just to manage the pain and complications, what you can do is you can apply cup, that is the strong cupping over the affected region, and along with that, after that, and also the surrounding muscles, then do myofascial release with the help of massage cups, and then do fire cupping, which we do it like the glass cups. Okay, so these three combination will work for any kind of chronic disorders. Any kind of acute disorders, as I've told you, for frozen shoulder will be helpful from ice cupping point of view. But if you understand from the chronic disorders, will be very helpful from strong cupping, then myofascial release with the massage cupping, and then will be fire cupping. So these three help in reducing inflammation, helps in mobility, relaxing the surrounding muscles, and of course the pain will of course subside to some extent. So this is also one of the good management through for frozen shoulder. Yes, next. Yes, same thing. Yeah, go ahead. Next. Yeah, cough and cold. Okay, cough, cold. Yes, of course. Cough and cold can also be very effectively managed. See, I'll tell you, where there is a recurrent cough and recurrent cold, that is upper respiratory tract infections and other things, for that what you can do is, there is a new phase of cupping now which is going, which we call herbal cupping. Herbal cupping is nothing, where what we do is we take these kind of bamboo cups. These kind of bamboo cups are being taken and we use our herbs. See, I'm telling you from Ayurveda point of view, just try to apply your own minds with your own systems. So what I usually do, from I'm sharing my experiences, I usually take Vasa. Have you heard about Vasa? Vasa is a herb, that is which is Ada Toda Vasika. What I do is I take that herbs and make a decoction. Once I make a decoction and I keep this herbal into the decoction. These I'm telling all remedies, which is emergency management, which you can do it for yourself, for your home, for your family, everyone. Okay, we have tried this for many patients and I've seen very effective results in at least subsiding the cough and cold. Okay, so once we apply that, now what happens in this bamboo, the complete herbal essence is being transported and absorbed in this bamboo, and then what we do is we apply it over the respiratory tract area. In turn, helps in reducing the cold, but it should be little lukewarm when you're applying the cup. When you're applying this bamboo cup, it should be little lukewarm. Then only it will show its therapeutical effect. Clear? Next. Gastritis, I'll tell you, it's one of the most effective results after your musculoskeletal disorder. If I would rate which would be the best treatment which you can see better results is gastritis. Okay, gastritis is nothing simple. What you can do is apply ice cupping, nothing else, nothing else. Just even if anyone has gastritis even today or now, whoever is having, just do one thing: don't have any kind of antacids, don't have any kind of carminatives and other things. Simple, what you can do is simple, take this. Yes, Vasa is also known as Malabar nut. Correct, perfectly right. It is a Malabar nut, which is called Adathoda vasica, which helps in reducing pitta and kapha disorders. Okay, so now in this stomach region, what you do is keep the ice cube and apply it over the stomach region and keep it for how much time? 5 minutes. Just daily, if you do this exercise for 5 minutes, obviously it is very, very effective. Yes, but it is contraindicated in pregnant women's, contraindicated if it is, any kind of surgical areas, if it is there. Okay, all that area has to be contraindicated. But in general, but I'm telling you, you can apply ice cupping over this region and keep it for, you can pull for 3 minutes, keep it for 5 minutes. Do 3 pulls of the gun, keep it for 5 minutes, and you will obviously see that area becomes so easy, and your stomach and abdominal muscles become so relaxed, and that area becomes so cooling, and whatever you eat gets digested also properly. So this is the major thing. Major thing is what? Inflammation comes down immediately after performing ice cupping. I tell you, this is a complete new understanding about cupping. So I would appreciate, because we have tested with many patients and seen wonderful results, and of course many of the practitioners also who have been trained under us, they also practicing, have given wonderful feedbacks about that, and that is how we are sharing you out of our experiences. Kindly use ice cupping for all gastritis issues. Okay, yes. Next. Yes, it's strong cupping, correct. GRD. Okay, so next, GRD again, gastroesophageal reflux disease. Yes, of course, gastroesophageal reflux disease here needs some manipulation technique. Okay, gastroesophageal reflux disease needs what? One, ice cupping over the stomach region, and some strong pulling over the esophageal. And also, or two things you can do. One, either strong cupping over the esophageal region, or ice cupping over the esophageal and also stomach region. All these region for GRD, if you will do ice cupping, obviously what will happen? The symptoms, whatever you're getting, like burning sensation and other thing, will obviously subside within span of time. Now, I'm just giving you some of the examples. Now, just try to correlate all these examples into various abdominal issues. Like you take it like gastric ulcers, you take it like duodenal ulcers, all these things, everything, you take it in that point of view and control ice cupping. I'm telling you, ice cupping is a trend now, is a matter of treatment now, which has to be employed in each and every by each and every practitioners. And also, even if it is for some people who would like to do it like a home remedy. So that's the reason I'm not going more into pathology, just telling you, just apply it. If you have general gastritis, even in home, obviously it will subside. Okay, next. GRD, yeah, not required. Dyspnea, yes, of course. Dyspnea also same thing. What are we trying to do for dyspnea is just apply cups as it is being placed bilateral of the airways. Take it from the respiratory tract and up to the nose. What you can do is, here you can apply 3 complete pulls of the gun. 3 complete pulls of the gun. Dyspnea, if you do this, obviously you will see the breathlessness, the shortness of breath obviously being improved. The airways gets dilated. Okay, one that because of the spasm, what happened, there is restricted movement in the airways. So what now, once we are trying to do one strong cupping on the either side and up to the respiratory, upper respiratory tract, what happened? The airways get dilated and there is a perfect sense of breathing. So you can see this is many of the people we have done, and this is how it gives a good result for dyspnea. Yes. Strong cupping in the sense 3 complete pull of the gun. You need to put 3 complete pull of the gun on the either side up to the respiratory tract. Yes. Then next it is sore throat and hoarseness of voice. Sore throat, hoarseness of voice. Yes, yes. All whatever we are talking today is not wet cupping. Okay, today whatever we are talking is only about dry cupping. Okay, dry cupping and emergency management, and not even pathology. It is only an emergency management, how you do it in your daily practice and your some of the home remedies. That is all. Now this is about the sore throat and hoarseness in voice. Sore throat, if you can see, there is another new trend in cupping which has come, which is called as magnetic cupping. So very rarely people use this, because we all know that magnetic cupping has what? It has a polaris effect, which one with that which repels, another which that attracts, correct? So accordingly to that, so we manipulate accordingly to the disease wise. So here, because of the hoarseness and sore throat, okay, what we have done is we have done lukewarm cupping. That is called water cupping. Water cupping, if you will see, this is how the two areas we have done water cupping, and the rubber top or the magnetic cups, whatever you have seen, we have applied on the either side. If you can see the ventral side of the throat and also dorsal side, okay, both the sides we have done it because we needed a polaris effect over that region to show its magnetic effect. So immediately after doing it, the patient felt very relaxed. Not only with this, we have done it for many patients and showing very good result for sore throat and hoarseness of voice. For y'all, in general, maybe not everybody will be having magnetic cupping. So now, as a home remedy and as a general, what you can do is, as a home remedy, as a general, what you can do is simple. Take a plastic cup, insert, fill one third of the cup with lukewarm water and apply it over the throat region and keep it for 5 minutes. That's more than enough. Okay, it's more than enough. You will see very effective results in that itself. Okay, next. Sore throat and hoarseness, same thing. Okay, this is we have done it with. Then again, stomatitis, hoarseness, soreness in lips and stomatitis. What you can do is in soreness in lips and stomach, what we have done is we have done ice cupping, because the patient was unable to make a movement over that region, and I have done a slight massage over in the lips. You can see this one in the lips. We have done a slight massage over the lips and applied the ice cupping over the complete area. And immediately after doing that, the patient was able to open the mouth and able to eat. And not only this, but also stomatitis also needs to be targeted over the stomach region. That is the root cause. Okay, the stomach region, as I told you, ice cupping. One, ice cupping over the stomach region. Second, also needs to be done over the face region surrounding the lips, from the outer angle of the lips, and then do a slight massage over the lips. Obviously, the soreness in lips or stomatitis will be controlled, but this will not suffice the medication. Medication has to be done on its own. Medication should not be left. Okay, along with medication, what you can do very fast to fasten the recovery action is this therapy. I'm telling you, very effective results for soreness in lips or stomatitis. Next. Pyrexia, yes, as per Ayurveda, I'm telling you, as per Ayurveda, the first line of treatment is what? Langana. Langana is fasting. During that procedure, if we are completely doing from the Ayurvedic point of view, then during Langana, what you can do is apply water cupping all over the body so that the fever reduces. This is all the concept for pyrexia. Okay, during Langana period, okay, whenever you're going for Langana, that is fasting as per Ayurveda, because Ayurveda does not advise to take immediate medication, okay, unless it is different Sannipataja, Jwara and other thing, not to be taken immediately. So during a general line of treatment for Jwara, that is for fever, is Langana is the first line of treatment. For during that fasting period, what we do is we go ahead with the pyrexia. Pyrexia, what we do is we just apply water cupping over the complete body so that the body gets cool, and also the complication, pains, and the other things, whatever the other complication happens due to the pyrexia, that also will be managed accordingly. Correct? Next. Burning sensation, neuropathy problem. Okay. Any kind of burning sensation, neuropathy problem has to be always, just understand, anything, whatever is we are finding, neuropathy problem or any burning sensation, has to be done a reverse treatment. Okay. Reverse treatment can be done with only two things. One, either you can do strong cupping. Second, what you can do is with the water cupping or with ice cupping. These are the three things which you can do it over that affected region to remove or to reduce the burning sensation or neuropathy pain. Okay. So many of the neuropathy pain, like you can see the motor nerve damage, the muscle loss, the muscle contraction, all that things, bone degeneration, all that things, we are not at all discussing as per pathology. I'm just telling you as a general symptom how you can control the neuropathy pain. You understand? We can do, but that has to be targeted from the pathological point of view. See, here we are discussing only on emergency management. Now I cannot explain about the pathologically how you can target, which organs to target, and what all needs to be done. You understand? There's specific line of treatment for every disease, but now what we are understanding is a general complication, how to manage the general complication if it is arise due to burning sensation. You understand? It's like that. Next. Of course, this also gives very effective results. Insomnia, I tell you, insomnia, sleeplessness, where due to many factors, psychological factors, and many things are there. What we do is simple, nothing we do. We just apply ice cupping. Nothing. Go to the next slide and show them the ice cupping. Nothing. What you do is simple. Do ice cupping over that affected region, and you will, and keep it for 5 minutes. Keep it for 5 minutes, and you will see there are many patients, many patients I have seen. Once I do the ice cupping, immediately they fall asleep during the treatment. I'm telling you. So it's such a wonderful treatment, and also such a wonderful results you get in insomnia. So so this is how it is. So especially we do it over the head region and covering the complete head. This is how the insomnia has been targeted, and of course it gives a good result for insomnia and sleeplessness. Next. Beauty and aesthetic disorders. Yes, as we all know that today cupping is far, if we understand, is going to the more into the West, adopting Western cultures, as and then the popularity is gained in Western, UK, US, and other countries. So now cupping as an aesthetic. Now people, you won't believe, people are now coming for aesthetic effects, like they want to remove the scars, they want to do the under eye treatment, they want to do upliftment, they want to do for acne and pimples, they want to remove the hyperpigmentations, many other things. Okay, if you, you can see this patient which we have shown before and after, it just done an upliftment, and such a good result has been happened just with the help of cupping massage. Nothing we did, we just did cupping massage, and immediately there is a result for the upliftment and the stiffness, and the and you can see the complexion, many other things, softness and detanning. All these will be taken care in the aesthetic of it, but these all are not wet cupping. These all are done only with the dry cupping. Okay, finally, last, yes, it is also for, yeah, next. This is how it has been done. Okay, yeah, next. This is osteoarthritis. Okay, osteoarthritis also we need to understand from the pathological point of view. Again, osteopenia, osteoporosis, many factors are there. Rheumatoid arthritis, gout, many things are there which we need to understand from the pathological and accordingly target the disease. But from the general point of view, what you can do is only three things are more than enough. Okay, three things are more than enough. If it is again, just what? If it is only an injury, just everything is all right, There is no other complication. Only the pain is caused due to knee pain is caused due to injury. Just apply ice cupping. Just apply ice cupping over that affected region. Okay, and then if it is chronic, if it is chronic in terms of like OA and other things, simple, what you can do is you can manage the disease. But osteopenia, osteoporosis, another thing, obviously medication should be the first line of treatment. Your medication is the first line of treatment. Then along with the medication, what you can do here is to increase the mobility and to manage the pain and other inflammatory conditions, what you can do is simple, apply strong cupping over the knee region. And after applying the strong cupping over the knee region, then immediately do fire cupping over that region. One, strong cupping and fire cupping. Do not do massage cupping over the knee region. Sometimes it may increase the inflammation many of the time, because many of the time it will be or in osteoporosis conditions, you cannot do much of massage cupping. Okay, so avoid massage cupping. Earlier in the times, even we were doing massage cupping thinking that yes, it gives good result, but what happened, it increases. So rather than, if it is an acute, do ice cupping, and if it is an chronic, do strong cupping. And if you all know about needle cupping, can be done needle cupping or fire cupping. These three are the best combination for osteoarthritis. No, if it is hemophilia patient, you need to understand, obviously hemophilia patient, dry cupping can be done. You understand? For hemophilia patient, dry cupping can be done, but wet cupping, of course, we all know the pre-procedure for hemophilia. What we have to do, we have to understand the clotting time, bleeding time, and other thing, and then we decide on the wet cupping point of view. Clear? Yes. So now we are done with the session, which is a management of cupping therapy in daily practice. So I'm sure that first I'll ask you all questions, if any, please.
अस्सलाम वालेकुम सर।
Yes.
किडनी इन्फेक्शन के लिए कुछ जो किडनी में स्टोन का तो नहीं है, कुछ किडनी इन्फेक्शन के लिए क्या कर सकते हैं सर? किडनी इन्फेक्शन
see, for kidney infection again ये pathological हो जाएगा, समझ रहे हैं ना? तो पैथोलॉजिकल होने के कारण मैं आपको यही बता सकता हूँ कि क्योंकि इसको समझकर करना चाहिए, तो इट इज बेटर यू अप्रोच द नियरेस्ट प्रैक्टिशनर, या आप प्रैक्टिशनर खुद हैं तो ठीक है, नहीं तो नियरेस्ट प्रैक्टिशनर को आप अप्रोच करें और उनसे सलाह लेकर आप किडनी इन्फेक्शंस को करें, क्योंकि किडनी पे बहुत सारे चीजें, पैथोलॉजिकल एग्जामिनेशन, बहुत सारे चीजें देखकर बाद में डिसाइड करना पड़ता है कि क्या ट्रीटमेंट करना पड़ता है। बट फ्रॉम द इमरजेंसी पॉइंट ऑफ व्यू, अगर वहां पे दर्दें हैं, क्रैम्प्स आ गया है या कॉलिक पेन है, देखो मैं आपको बता रहा हूँ, नॉर्मली यूरेट्रिक कॉलिक पेन होता है, तो वो पेन को आप कम कर सकते हैं, आइस कपिंग लगाएं पेन के लिए, कम होने के लिए। बट इन्फेक्शन के लिए मैं नहीं बोल पाऊंगा कि ओनली कपिंग थेरेपी विल हेल्प, वी नीड टू अंडरस्टैंड एंड देन डू इट।
जज़ाकल्लाह खैर।
नेक्स्ट।
हेलो।
यस।
हाँ नमस्कार सर।
नमस्कार।
फेस इडिमा के लिए हम ड्राई कपिंग कर सकते हैं, और थायराइड के लिए आप कुछ बता सकते हैं?
जी हाँ, देखिए थायराइड के लिए, देखिए अगर ये हार्मोनल है, देन अगेन हम लोगों को समझना चाहिए हाइपर सेक्रीशन है या हाइपो सेक्रीशन है। तो हाइपर और हाइपो सेक्रीशन के लिए सिंपल सी बात, आप क्या करें, डायरेक्टली थायराइड ग्लैंड और पैराथायराइड ग्लैंड को लेते हुए पिट्यूटरी ग्लैंड कर लें, अगर आप डॉक्टर हैं तो। अगर आप डॉक्टर हैं,
आई एम एन आयुर्वेद कंसल्टेंट।
हाँ आयुर्वेद कंसल्टेंट, हाँ, तो आप क्या कर लें, यहाँ पे आप थायराइड ग्लैंड, पैराथायराइड ग्लैंड और पिट्यूटरी ग्लैंड को आप टारगेट करते हुए इसको स्टिमुलेशन कीजिए हर रोजाना। बट अगेन अंडरस्टैंड, थायराइड को हम इसको बिल्कुल ये इरेडिकेट नहीं कर सकते, ठीक है, क्योंकि ये हार्मोनल है, बस मैनेज कर सकते हैं। अगर आपका जो भी हाइपो के जितने भी कंडीशंस हैं, सिम्टम्स हैं, जितने भी साइंस वगैरह है, उसको हम लोग कम कर सकते हैं और कॉम्प्लिकेशन को मैनेज बहुत अच्छे से इन जगहों पे लगाकर कर सकते हैं हम लोग।
जी सर। और फेस एडिमा के लिए हम ड्राई कपिंग कैसे यूज कर सकते हैं?
यस, फेस एडिमा, देखो फेस एडिमा को हम लोगों को क्या चाहिए, वी नीड समथिंग उष्णा इन नेचर, राइट। उष्णा इन नेचर को क्या लेके आ सकता है, बेटर इज फायर कपिंग, डू सिंपल, क्या करो आप लोग वहां पे lymphatic ड्रेनेज के लिए स्ट्रॉन्ग कपिंग कीजिए ओवर द फेस रीजन. डोंट कीप इट मोर देन 5 minutes. अंडरस्टैंड? तो 5 मिनट छोड़ने के बाद में नेक्स्ट गो अहेड विद द फायर कपिंग.
ओके सर, थैंक यू सो मच.
थैंक यू. अगेन फेस एडिमा फिर चेक करना पड़ेगा कि फेस एडिमा किस वजह से आ रहा है. पैथोलॉजी हैज टू बी ऑब्वियसली ओवररूल्ड एंड देन गॉन. वी नीड टू अंडरस्टैंड कपिंग इज गुड इन मैनेजमेंट. Again, I'm telling you, this is not only the treatment for all pathological conditions.
Yes, definitely.
Next.
Assalamu alaikum, sir. For optic problems like neuritis or any blockage in the veins.
See, blockage in the vein, neuritis and other things, what you can do is directly do medium cupping, taking it from the taking it from the optic area up to the optic nerve. Take it from the complete pathway लेकर उस area में medium cupping करो. Only one challenge what you will face doing it in the or targeting for the optic area is because the cup has limited suction. You need to have a suction machine to attain a suction over the hair region, because once you start doing cupping like this area and traveling up to the optic region, ठीक है, optic nerve, so you need to have completely the suction machine to attain the suction. But of course it will help in management. I'll tell you, you can see some differences, some results also. And like for conjunctivitis, if you see for lacrimal ducts, you see for many of the the like squint eyes, you see many of these things are showing good results through cupping therapy. So I don't say myopia, hypermetropia, ये सब चीजों पे ज्यादातर नहीं पाया गया है. एक cases detachment of retina पे भी नहीं पाया गया है, because those are very chronic and other things, pathology बहुत involved है उसमें. But हाँ, जहाँ पे एक case one of my student have done for optic nerve atrophy, doing it for continuous for 1 year, they have seen the reversal of that, and बहुत अच्छा, very good results have been found for optic nerve atrophy, which is only been found with only one patient. So I cannot till say until even we all get into these kind of therapeutical aspect and then come up with some more feedbacks on that. Okay.
अस्सलाम वालेकुम सर.
Islam, yes.
जी सर, मुझे पूछना था इंसोम्निया को लेकर के. इंसोम्निया यू आर सेड दैट हम लोग घर पे कर सकते हैं, बट वी डोंट हैव दैट इंस्ट्रूमेंट्स लाइक दैट. सो क्या वो सिर्फ कप से हो सकता है, प्लास्टिक कप से?
हाँ, प्लास्टिक कप से नहीं हो पाएगा क्योंकि सक्शन चाहिए ना. इट नीड्स अ कंटिन्यूस सक्शन, स्टिमुलाई चाहिए. तो उसके लिए आप क्या करो, आप हमारे टीम से कोऑर्डिनेट करो. कोऑर्डिनेट करने के बाद में उनको पूछ लो, या शाइस्ता वगैरह हैं उनको पूछ लेना. दे विल टेल यू where you can get those kind of things and you can employ in your treatment.
Okay, thank you so much.
Any others?
Assalamu alaikum, sir. Sir,
Yes.
for insomnia, how many times we need to apply the cup, sir? How long, like?
You keep it for 5 minutes.
Okay, do we have to repeat weekly once or like twice
You
in
do
a
it
week?
daily. For example, understand depending on the chronicity of the patient. If the chronicity is more, repeat it daily. If it is no, then do it like weekly, twice or thrice is more than enough.
Okay, sir. Thank
The
you.
line of treatment has to be understood by understanding the patient. But as of now, from the home remedy point of view, you can just do ice cupping over the head region. Yeah.
Thank you, sir.
With the gun, it can't be happen, right?
With the gun, it's very difficult, right? Because the hairs are there and it won't stick, or it will not attain the suction with the hairs. You need to obviously have an external stimuli which can adjust with the pressure.
My mother is suffering from that, so that's why I ask you repeatedly.
Yes. See, if you would want, you can do one thing. Sometime you can get in touch with us. I'll share you how the machine cupping works. You can do it in do it with your. Are you a doctor?
No, sir. I'm just a CTA. I'm doing CTA from yours.
No, for that you consult doctor, and then I'll tell you. Okay.
Okay. Thank you.
Assalamu alaikum, sir.
Yes.
For varicose vein, is ice cupping better?
For varicose vein?
Is ice cupping better?
See, for varicose vein, if there are cramps, if there are pain surrounding the varicose vein, yes, of course, ice cupping can help if it is acute. But you also need to understand varicose vein is completely an incompetency of the veins. अब incompetency of the veins की वजह से क्या हो रहा है, वहां पे circulation नहीं हो रहा है. So only ice cupping will not help in enhancing or bringing circulation to that particular vein. So for varicose vein, the best treatment what we have in Ayurveda is Sira Vedana. Sira Vedana or Vini section, which we say, which we remove the blood or the thrombosed or the thrombose, wherever the thrombose or prominent veins are, हम लोग वेन से निकालकर उसको रिलीज करते हैं ताकि वो एरिया सर्कुलेशन पे आ जाए. बट हाँ, ये जो मैनेजमेंट है पेन वगैरह का, ये सब चीजों पे आप लोग बिल्कुल फ्रॉम होम रेमेडी से कर सकते हैं.
Okay, sir. Thank you, sir.
So okay, I think yes.
सर कराटे लेते हैं ना, उसके लिए पिकअप्स लगा सकते हैं क्या?
हाँ, ऑफ कोर्स लगा सकते हैं. तो ये क्वेश्चन इससे पहले भी आया था तब in my other session. So कराटे के लिए बहुत सारे स्नोरिंग वगैरह बहुत सारे रीजंस कॉजेटिव फैक्टर्स होते हैं. ठीक है ना. सिंपल एक ही चीज क्या कीजिए, स्टमक है ना, स्टमक पे स्ट्रॉन्ग कपिंग कीजिए.
शुक्रिया.
Stomach पे strong cupping, keep it for 5 minutes. People have given good feedbacks on that. Okay, fine. Thank you guys. Thank you very much for attending the webinar. It was really happy, and I'm really privileged to share my knowledge on the management of cupping in daily practice. And I would really like to thank HSSC team, Ms. Anshu ma'am, Dharminder sir, Ashish sir, Pooja ma'am, Dr. Neha ma'am, Neha Khanka ma'am, for all of them being always in supportive in uplifting the Ayush courses, and also bringing a lot of upliftment in the Ayush sector. We always be thankful to them because they are doing a lot of efforts and lot of bringing a lot of things and changes in the Ayush from the skill point of view. Thank you very much for inviting us, ma'am. And that is all. Thank you. I hope everybody liked this session and try to implement in your daily practice. And who are not doctors, kindly get in touch and get consult with the therapist and doctors, and then take it from the pathological point of view. Thank you. Thank you very much. Thank you once again.
Thank you so much, Dr. Nadeem, for the wonderful session. Thank you, participants, for joining.
Jazakallah khairan.